So my part of the presentation is reasons of usage, cons, and relative effectiveness. So to answer the question of why to use contraception, you need to understand the purpose of birth control. Although people may choose to use contraception for a variety of reasons, the purpose of the different types of birth control remains the same. Contraception allows you to prevent pregnancy. Then we can understand the use of contraception. It helps you determine how many children you want, as well as the timing of your pregnancies, which is what is being discussed on the first slide. The use of contraception can significantly lower your chances of becoming pregnant, and some types of birth control can even lower your risk of contracting a sexually transmitted infection. It the bullets are it helps you determine how many children you want, if any, the timing of your pregnancies, more stability or control of your life, and a lot of times maybe you don't have a stable partner for parenting the child, so you might not feel like you could give the child his or her best life. Um, you might feel too young or not ready. You might want to stay in school to better finish your education, and you might want to better take care of yourself or your family. You might want to focus on that before you want to have a child. You might want to prepare or have a career. So, given the increasing demands in schooling necessary to even qualify for a well-paying job, it's more than ever important for teens to finish high school and then attain a post-secondary education when possible. Forget about a high school education. You would need to go to college, earn the proper degree for its corresponding career that would help you support yourself and your child and your parenting needs. Yet overall, only about half, like 51% of teen mothers get a high school diploma by age 22, compared to the 89% of women who didn't even have a teen birth. Young teen mothers who have a child before they turn 18, they're less likely to graduate from high school because it's just more difficult to raise a child while studying for like the SAT and, applying for colleges. Fewer than 4 in 10, like 38%, get a high school diploma, and another like 19% get a GED, which is a general education development. So the theory is, especially at our age, if you do choose to be sexually active, then it's extremely recommended to use contraception for all of the reasons I just mentioned. And also, there are health reasons. So slide 2 is about those reasons. I want to remind you guys that in the worksheet that I showed you guys, there is a fill in the blank section which is mostly on the health benefits, and there is a chart. So all the pros that I'm talking about right now, you should include that in the pros section of the column, and then after that I'm going to go over the cons of every specific type of contraception method, and then you're going to use that in the cons so that you'll be able to choose when the time comes. So the certain types of contraceptive methods that we went over in Crystalline's and Chloe's presentations, um, they can decrease the risk of ovarian cancer. For example, the pill, it reduces your risk of ovarian cancer by at least like 40%. And the longer you use it, the more it helps. This is true for women even with a family history of ovarian cancer. And since the patch and the ring, they all have the same combination of hormones as the combination pill, which is another name for the pill. It's estrogen and progesterone, if you guys don't remember. Since they have those two hormones in common, we expect they also protect against ovarian cancer. Other hormonal methods, including maybe you've heard of the shot, the implant, the hormonal IUD, they also protect against endometrial cancer, which is the cancer of the uterine lining. So in female anatomy, we learned about the uterus and the positioning of everything. So the uterine lining, the cancer of the uterine lining is what endometrial cancer is about. Certain types of contraceptive methods, they also help with ovarian cysts. We went over this in also female anatomy, I think. Ovarian cysts are fluid-filled sacs or pockets within or on the surface of an ovary. And one of the main ways hormonal birth control prevents pregnancy is by stopping ovulation. So the egg never leaves the carton, so to speak. The pill, the patch, are the most reliable at blocking ovulation because, like, when you put it on and stuff, or you take the pill, they directly control a woman's hormones. So a woman using these methods may have fewer ovarian cysts. So I know we said that they aren't dangerous. Like a lot of women, they have ovarian cysts throughout their lifetime and they don't even realize it. And that's true. But if you continue to have them for a long time, sometimes they can cause complications, and those complications are the things that we're trying to prevent. So yeah. So the next couple bullets are like heavy, painful menstrual cycles, regulate menstrual cycles, reduce acne. So they also help with these kind of things. So usually, adolescent girls and young women, they're frequently prescribed the birth control pills, which are also called oral contraceptive pills because you can take them by your mouth. Hormonal pills, or simply the pill, for irregular menstrual periods. So if like in 1 month a woman might have her period starting on the 2nd, and the next month it starts on like the 20th, so that's really irregular and that can cause a lot of problems for the body. So for controlling that, the pills prescribed: menstrual cramps, acne, PMS, endometriosis, hormone replacement therapy. So the last things, they're not really that important, it's just maybe you've heard of them, so to draw that connection. For example, girls diagnosed with polycystic ovary syndrome. We learned about this in another topic, one of the earlier presentations. PCOS, it's a hormone imbalance which causes irregular menstrual periods, acne, excess hair growth. Like to control these things, women are prescribed birth control pills. It lowers their hormone levels to a normal range, and they regulate the menstrual periods. Girls with acne, usually they have like creams and like dermatologist recommended stuff, like but if a girl is not responding to that, to simple measures, they're often prescribed birth control pills. Um, Girls or women whose ovaries are not producing enough estrogen, and this can be because of radiation or chemotherapy, which is caused by cancer, or excessive exercise, anorexia nervosa. Maybe you've heard of that. They either damage the ovaries, or they cause some kind of hormone imbalance, in which there's not enough estrogen. So a lot of times, girls are prescribed birth control pills to control that estrogen, because, like, for example, when you take the birth control pill or the patch or whatever, it controls the hormones in the ovaries so that the egg is not released. So it's for that. And so these things can also be affected. Um, Endometriosis, I don't know if you guys know it, it's not that important, but it's also affected in cycles or continuously to suppress that condition. So that was a lot of information. So if you want, for the chart, if you want to take notes for that, the health benefits were regulation of menstrual periods, decreased menstrual cramps, treatment for acne, treatment for polycystic ovary syndrome, you can just write PCOS, lowered risk for some cancers, and we don't really talk about this, but if you want, you can write lowered risk of anemia. That's just an FYI. That's not something we went over. Slide 3 and 4 are about the economic benefits. So contraception isn't just used to, okay, I don't want to get pregnant, I'm in school, I want to finish my education. It's not just that. There's also health benefits that we went over, and then there's economic benefits. So according to the Department of Agriculture, the annual cost of a child in a middle income, like a 2-parent family range, it ranges from $12,600 to $14,700, and that's a lot. So childcare costs U.S. taxpayers between 9.6 to 12.6 billion a year. Like, why is that? We're not even the ones getting pregnant. It's because Medicaid is this national thing that covers almost half of the births in the U.S., which is like 45% or something. And so embedded in this conversation about birth control access is a cycle of poverty. So the next two bullets kind of go together: parents' decreased investment in their children, and a cycle of poverty. So this is really important. So you guys can include this in your worksheets after. Especially for those people in low-income households, because income inequality is growing, families without access to reliable contraception are possibly at a greater disadvantage. Think about it this way: poor children have they experience more health problems. They live in more dangerous neighborhoods. They have like higher rates of delayed academic development. So they, in the long run, have lower test scores. They're less likely to complete high school or college, and they limit their earning potential as adults. So when teenagers or students have pregnancies, regardless of their pre-existing economic status, they all find it hard to complete their education, like high school or college, much less continue to get an advanced degree. So when their parents, even if the parents are willing to support them, it's still hard. So when teenagers don't get advanced or even basic education, it's almost impossible to find a well-paying job that can support you and your child and all the parenting supplies. Plus, this job has to work with your timings. Like, you have to take in mind your child's like sleeping and eating and like pooping timings, which you need to be taking care of because you're the parent. So when these teenagers they can't provide their children with a well-off life or economic status, so that child would go through everything a low-income family would, as mentioned earlier. So to kind of summarize that, there's a middle-income family and a low-income family. A low-income family has they both have they so this is like the person, right? And they both get pregnant. They both have find it really hard to finish their education and support their children. But in a low income family, the parents are already struggling to take care of the family that already exists. So another child would be really hard. So now this both of these people, especially this person, needs to take up a job. And this usually means either quitting high school or like not getting good grades or not passing or something because you have to work in the afternoons. So now they're both having like delayed academic development, and so either they don't go to college or they go to a really bad college or not don't or a degree or something. So if they don't have a well-paying job which is supported by that degree, then they can't support their children. And this family already had like less money to begin with. So it's harder for them. And now so they don't have a good job and they can't provide their children. So these children grow up with the same things that this family did. So this family is also going through that cycle, but this family is at a greater, like potentially a greater disadvantage. Thus, the cycle of poverty. Just to kind of summarize these three slides, contraception extends well beyond a woman's decision about when or whether to conceive. And access to reliable family planning goes deeper than a woman's personal well-being. It plays a pivotal role in the financial, the physical, the emotional health of the children. And there's data and evidence that suggests that effective contraception and positive social outcomes, they're mutually reinforcing. So in the end, empowering women, regardless of their socioeconomic statuses, when they have more options to control pregnancies and they're more available, this has benefits for everyone. So that was all the pros. So now the cons. You should have your pros chart and all the fill in the blank filled out. Cons. For abstinence, some forms can still spread disease. So contrary to popular belief, some people think like, oh, oral sex, mutual masturbation, or anal sex. I can't get an STD from that because it's not vaginal sex. But you can. You still can get infected. So the rule is, you should write this down. Any skin to skin, genital to genital, hand to genital, or mouth to genital contact can cause STD infection. Contraceptive patch. Itchiness, redness, soreness. You put it in many places, as was described in the other presentation, but it can lose the stickiness, like in the shower or something. Like it can detach from the skin, either totally or partially, and that makes it less effective. Some small illnesses can be side effects. If used while breastfeeding, it can reduce the amount of milk produced. It's not effective for people over 198 pounds, so they need to find something else. Diaphragm, it does not protect against STDs. It needs to be fitted by a healthcare provider. So this also means if you like gain 10 pounds or you lose 10 pounds, then you need to be refitted. Some women might be allergic, so make sure you get it tested by the doctor. And it can cause an increase in urinary tract infections. Birth control sponge. It does not protect against STIs. It may increase the risk of HIV infection in women, and women may be allergic. It's the non-oxynol 9, I think. They might be allergic to that. And it can also increase urinary tract infections. Birth control pills, the infamous. This has a lot of pros, as we talked about earlier, especially in the health department. But it does not protect against STDs or HIV, and it's not that effective when it's taken with other medications. So let's say you have like having a terrible headache one day, so you take a Tylenol. It might not be as effective if you're taking that Tylenol and this at the same time. It may delay return of normal menstrual cycles, and it must be taken every day at the same time. And it can't be used by women with certain medical problems or women taking certain medications. So this does need a prescription, but you really need to talk to your doctor about whatever pre-existing medical conditions you have, your menstrual cycle, and how else to prevent the STDs. It can occasionally cause some side effects. So if those side effects, you need to talk to your doctor, obviously. The male condom, it's very common. This and the female condom are potentially the only things that methods that protect against STDs, because it's preventing the actual contact of genital to genital, as the rule I just told you guys about. The other things is preventing the pregnancy, like the sperm or the egg or the contact of them, or like it's killing the sperm or something. Like it's not preventing the contact of the two genitals. So the thing about male condom is that you have to use a new one every time you have sexual intercourse. It can break, so a lot of times women are like, oh, I need to go get the morning after pill, our condom broke. That's what they're talking about. And a lot of times women are allergic to latex, so you really need to like make sure you're not, otherwise it can cause problems. The female condom is the same thing. We need a new one for every sexual intercourse, but it can also move or like be noisy or uncomfortable. So if that's something you need, if you're worried about, then yeah. Female sterilization. Okay, so you need to have a minor surgery, which costs like $2,000 or $2,500. So a lot of times, really like women who are really sure that they never ever want to have children ever again, that those are the ones who use it, and doesn't protect against STDs. So I don't know if this example helps, but if you watch Grey's Anatomy, there's a woman and she tells her obstetrician to tie her fallopian tubes together. This is sterilization. So the tying of the fallopian tubes, cutting, tying with the rubber band, cutting and then tying, inserting a tube so that the muscle mass grows around it, so that this egg cannot be released through the fallopian tube into the uterus. That is a sterilization. So if you don't have those $2,000, if you don't want to have surgery, if you might want children later on, you're not really sure, then don't have sterilization, because it's like 99% effective. And relative effectiveness. Abstinence, you're not even having sexual intercourse, so 100% effective. Sterilization, you're having a surgery that prevents the egg from getting out, so that's like 99% effective. The birth control pill, 91% effective. A lot of times, maybe one day you'll forget, or you take it a day late, or not at the same time every day. That's why usually it's not that effective. And since it's the same hormones as the contraceptive patch, estrogen, progesterone, again, it's 91% effective. The diaphragm is 88% effective. Male condom, 82% effective. The thing about the male condom is that it's the only thing that prevents against STDs. So even though it's 82% effective in preventing pregnancy, it's really effective in preventing STDs. Female condom is only 79%. Contraceptive sponge is anywhere from 76 to 88% effective. So if you guys have any questions, you guys can ask my other teammates. They're also there, I guess. Your worksheet should be all filled out, and now it's Abhishek's presentation.